Hello friends, my topic for today's discussion is regarding what are the risk factors, what are the complications of missed beats, what are the features and the factors which increase the incidence of risk factor in a given patient, and what are the problems which can be caused by having a missed beats. This topic is a subtopic which we had created from our missed beats video. We had already done a lot of videos on missed beats because this topic is very relevant. A lot of people keep on asking about them. What is the risk I am having? What are the problems which can have? Whether I can have a heart attack or not? Whether I can have a stroke or not? Whether I can expect myself to live a normal life or not? Whether I should be on medicines lifelong or not, what are the side effects of these medicines. So we have done separate videos upon what is the evaluation of missed beats we have done, what is the treatment of missed beats we have done, missed beats overview we have done, whether we should be afraid of missed beats or not, that we have done separately. Today we will be discussing about the risk factors and complications of the patient having missed beats. What are the common things involved in the treatment of missed beats. Treatment strategy we have already done a separate video, so I will not be going to too much of that detail. Risk factors part we will be covering today. This topic is going to be relevant and clinically useful, so I would request you to see the video till the end. The people who are new to my channel, I would request you to subscribe the channel to give us a lot of motivation and inspiration. If at all you have any comments, queries, suggestions or topics or any patient related queries, you can write to us about them in the comment section below and we'll be trying to answer them all. Now, what are the risk factors of having a missed beats? Missed beats is basically an interpolated ectopic or sudden charge or sudden current which comes from an abnormal site rather than from the normal site or the sinus node from where the current normally should generate. Normally the sinus node controls the functioning of the heart, and the sinus node produces the current. It distributes to the atria, then it current goes to the AV node, then it goes to the His-Purkinje fibers and gets distributed in the ventricle. Sometimes what happens that any site from the atria or any site from the ventricle might suddenly get activated and it will take up the conduction system. It will fire prematurely. For example, if at all the current had to come after 120 milliseconds, suddenly the current will come within 20 or 40 milliseconds and it will take over the conduction system of the heart. Suddenly, heart will not be prepared to handle them and the heart conduction system suddenly gets reset. This leads to a very long pause, and after the pause, the heartbeat which occurs is a very forceful and a very vigorous beat because the heart is overfilled at this point of time, and this leads to the post-systolic sudden surge of blood or sudden palpitation which a lot of people experience while they are having ectopics. So this is what ectopic is all about. Usually ectopics can be triggered by stress. Any person who is having a lot of lifestyle stress or anxiety in his mind, or working in a lot of condition of social stress or family related stress or work related stress, likely to have more amount of ectopics. If you control the stress, you are much more likely to reduce the amount of ectopics. Any person who is taking caffeinated drinks, much more likely to have because it contains a lot of caffeine, it contains a lot of energy boosting stuff which stimulates or triggers the heart. This can lead to a lot of ectopics. Person who is sleeping less, person who is working for the entire night and sleeping less, maybe 3 to 4 hours per day, is much more likely to have ectopics as compared to person who is taking a good amount of sleep. So the treatment is take a good sleep, reduce stress, drink less of caffeinated drinks. Then ischemia. If at all the patient is having multiple coronary artery blockages, then the ischemia will cause less blood supply in a particular area. This will stimulate or trigger a particular area's activity and this will lead to ectopics. So open up the vessels and this will reduce the ectopic frequency. Thyroid can also cause increased amount of ectopics because thyroid hormone which is produced in excessive in the body can stimulate the catecholamines. This increases the heart rate and also can activate the abnormal ectopic focus which increases the ectopics. Any cardiomyopathy or any structural heart disease in the cardiac musculature, whether it is a dilated cardiomyopathy, ischemic cardiomyopathy, restrictive cardiomyopathy or hypertrophic cardiomyopathy, all of them can be a milieu for ectopic beats, so it has to be treated much more aggressively. Any congenital or valvular heart disease, any valve related problem which is causing dilation of the heart or stretch of the heart, or any birth defect of the heart which is causing which is manifested in the form of hole which is causing mixing of the blood and dilation of the heart, these all are the risk factors which can lead to more amount of ectopics. Once you treat the problem, the incidence of ectopics might automatically decrease. Now what are the other issues with ectopics? Do the ectopics damage the heart? No, they don't. Usually ectopics will not damage the heart. If at all you are having too many ectopics which may be more than 10,000 ectopics per day, that is 10% of your daily conduction pattern, if it is going in the form of ectopics, then there are chances that the heart might get weakened and over a period of time the patient might go into a heart failure status. But usually that cardiomyopathy is also reversible. This is because of only depletion of the cyclic GMP and only depletion of the glucose stores of the heart. The heart muscle will be hypocontractile for some time, but after a certain period of time it will again restore its function, and the cardiac function will be again better once you control the ectopic. So this is not a permanent damage of the heart, it is only a temporary damage, usually not dangerous. Do ectopics increase the risk of sudden cardiac death? Too many ectopics, especially in a patient who is already having ischemic heart disease, cardiomyopathy or structurally damaged heart, they can be dangerous. But if at all the patient is having a structurally normal heart, the echo is good, the pump function is good, the exercise capacity of the patient is good, then it is much likely to be a nascent form of problem, nave problem, and it will not lead to any sudden cardiac death. Patient having multiple types of ectopics or multiple focal ectopics, that is one ectopic coming from this side, one from that side, one from that side, that is known as a multifocal ectopics. These patients are much more likely to have sudden cardiac death. Patients having increased frequency, that is every second beat is coming like an ectopic, which is known as ventricular bigeminy. Every third beat coming as an ectopic, that is 2 normal, 1 abnormal, which is known as ventricular trigeminy. Every fourth beat coming as an ectopic, which is 3 normal, 1 abnormal. So these are the patients where the ectopic frequency is very high. These are the patients who will require much more aggressive treatment, and the risk will be higher. But majority of the patients who are having less than 1000 ectopic beats per day are much less likely to have a heart failure, much less likely to have a sudden cardiac death. Whatever cardiac dilated cardiomyopathy or heart weakening does occur in these patients, most of the time it is reversible and rapidly reversible also. Within few days of starting the therapy also, the heart pump function will become almost completely normal. So any dilated cardiomyopathy in such patients should be treated aggressively, and the results will be extraordinary. If at all the patient is having pre-existing dilated cardiomyopathy and also ectopics are there, then they should be treated much more aggressively, because if the heart is already weak, the ectopics will increase the risk of sudden cardiac death, especially if the patient already has a history of documented tachycardia or already has a history of syncope. Then these patients should be treated much more aggressively, because the chance of the patient dying suddenly will be much higher. And these patients, high dose of beta blockers and sometimes antiarrhythmic agents should also be used if at all they are having too frequent ectopics. How much likely is that a ventricle ectopic will suddenly degenerate into a ventricular tachycardia or cardiac arrest might occur? Less likely in a structurally normal heart, more likely in a structurally damaged heart. As we have already discussed, a person who is having a structurally normal heart, the fear factor should be less. Although if at all you are treating yourself with beta blockers and medicines, you do reduce your risk of having a sudden cardiac death to a great extent, and you can control your ectopics. But patients who are having very less frequency of ectopics, maybe 1 or 2 per minute, they did not worry and they did not get themselves treated also. One thing is for sure, that if once you start the treatment has to be continued, sometimes lifelong in a few cases. So that is why only if it is necessary the patient should be treated. Otherwise, for majority of the patient, the symptoms will not be much and the complications will not be much, the problems will not be much, so they may or may not treat themselves. Next important question is, which is more dangerous, the APC or the VPC, the ectopics coming from the atria or from the ventricle, which of them is dangerous? Usually by convention it is believed that any ectopic or any abnormal activation of the ventricle is much more dangerous, because that can suddenly degenerate into a ventricular tachycardia. Atrial ectopic which degenerates into a atrial tachycardia or atrial arrhythmia, usually that can still be easily managed and the chance of the patient dying suddenly is very low in these cases. But if it is a ventricular ectopic and that too a multifocal ventricular ectopic, then patient has to be much more careful and it has to be managed more appropriately, especially if the frequency is on the higher side. How common is to have an ectopic? Usually 2% of the entire total population are suffering from this problem of ectopics. That is why it's very common problem, and all the patients don't require treatment. Only if you are having symptoms and only if you are having a structurally damaged heart, then you should get yourself evaluated. Of course, all the patients should get themselves evaluated. At least echo treadmill should be done in all cases. Holter should be done in most of the cases to see what is the frequency of ectopics. But if at all the ectopic frequency is not much, you need not treat yourself, because once the treatment is started, majority of the patients might require lifetime treatment, because medicines will not cure the problem. They will only temporarily control the problem and reduce the incidence of heart failure and reduce the incidence of sudden cardiac death. So if at all they are started, the decision has to be final and has to be continued for a long term for the patient. How often is it possible that the patient can be completely asymptomatic with having ectopics? It's extremely common, and almost 80 to 90% of the patients who are having some ectopics will not feel that they are having ectopics. Sometimes patients do a routine ECG and that ectopic is picked up, or you do a routine echo and that ectopic is picked up, and patient comes to us with that symptom. So having an asymptomatic or completely the patient not knowing the fact that he is having an ectopic related problem is very common, and patients need not worry about them. All the more likely that if at all they are not aware about the problem, they do not require treatment, because it is an asymptomatic ectopic, or once or twice having ectopics, they need not be treated. Only if the frequency is very high or the patient is not aware and is already developed cardiomyopathy, then we should treat this patient, and if at all it does occur and cardiomyopathy is already there, then we have to treat it quite aggressively. So in this topic, we have discussed what are the risk factors of ectopics and what are the problems which the ectopics can cause, what are the complications of ectopics. If at all you have any comments, queries, suggestions pertaining to this topic, or any other topics on which you want us to make more videos upon, you can write to us about them in the comment section below. Any patient related queries are also most welcome. The people who are new to my channel, I would request you to subscribe to my channel, as this gives us a lot of motivation and inspiration to continue the video and channel in future.